This is Dr. Jayashree Gopal here. I'm an endocrinologist practicing in Chennai. And today I'd like to discuss case-based presentation of the usage of basically combination therapy, specifically the combination therapy of DPP4 inhibitor and SGLT2 inhibitor in relatively soon after the diagnosis of diabetes, and how it helps in good control of the diabetes. The case that I'm presenting today is actually a 48-year-old male who had a history of a PTCA done at the age of 42 years. He did not have a diagnosis of diabetes at that time, was diagnosed with diabetes about 2 years after the PTCA. So currently he's been having diabetes for 4 years. Therefore, he's been on metformin 500 mg twice daily since the diagnosis of diabetes. He's also been on statins for his heart. No known history of hypertension, no other medical problems. Family history of diabetes in his mother, and he maintains a good lifestyle. He runs 5 days a week, and he monitors his blood sugars at home, and his fasting blood sugars were remaining between 120 to 140, and his 2-hour postprandials were running between 180 and 200 usually. His anthropometric parameters, his height is 172 centimeters and his weight is 85 kilos. Now, what had happened was, because of the lockdown, he had not got his blood test done through the lockdown. In September 2017, his HbA1c was 6.5 with a fasting blood sugar was of 114. He checked his blood sugars in the lab a year later, which was in November 2018, and his fasting blood sugar was 130 and his HbA1c was 7.3. At that time itself, we had discussed adjusting or starting new medications, but he felt that he had not been exercising as much as he should, or that his diet had not been as strict as it should have been. And like a lot of our patients, he said that he would come back after he'd made better changes to his lifestyle. However, after 2018, it slipped his mind to get his bloods tested in 2019, and the next time he checked his bloods was in the middle of 2020, in the middle of the lockdown actually. His fasting blood sugar at that time was 242 with a HbA1c of 11.8%. So as expected, he was in a complete state of panic and shock. He had continued to exercise. He had not actually felt unwell in any way. And we see this a lot in a lot of our patients. Even when the blood sugars are this high with a HbA1c of about 10 or 11, they do not have osmotic symptoms. They feel well because they've been maintaining a good, active, healthy lifestyle. Usually it's people who have a sudden onset of such high sugars who present with osmotic symptoms. But if the sugars have been going up gradually over the months and they maintain a healthy lifestyle, otherwise they may not have much by way of symptoms. The medication change that I did was I actually changed his metformin to 1 gram in the night after food. I put him on EMPA-LINA combination, 10 mg of EMPA and 5 mg of LINA once in the morning after food. I also emphasize a good no sugar and a lower carbohydrate diet, and I advise that he continued with his exercise. With this, exactly a month later, he came back. Obviously, now he knows this, and this is again something we see commonly. When they get a jolt like this, they are more careful about their monitoring, at least for a few months to a year later. Exactly a month later, with this combination, his fasting blood sugar was 96. And just to remind you that a month earlier, his fasting blood sugar was 242. And even within a month, his HbA1c had come down to 8.8 from 11.8. And all of the tests were done in the same laboratory. I also had him do complete glucose profiling, and ambulatory glucose profiling actually, to be precise. And it showed that most of his blood sugars were remaining between 100 to around 100. So between 80 to around 120 to 130, because he was very meticulous about following a low carbohydrate diet. He also lost a little bit of weight. His initial weight, if you recall, I had mentioned is 85 kgs. He lost his weight. His weight had come down to about 82 at the end of the first month. He repeated his blood tests again by October 2020. And at that time, his fasting blood sugar was 101 and his HbA1c now was 6.6. We had a discussion about how to adjust his medicine. His metformin was reduced from 850 to 500. And the morning dose of his tablet he reduced to half to see what would happen to his sugars. His subsequent blood test done 3 months later, which was by January 2021, on half a tablet of the EMPA-LINA in the morning with metformin 500 mg at night after dinner, showed a fasting blood sugar of 94 and a HbA1c of 6.3%. He was asked to continue with a good low carbohydrate diet and his regular exercise, and his medications are continuing. About 4 months later, his HbA1c came up slightly to 6.7. At that time, we went back up. His fasting blood sugar was remaining good. He'd gained a little bit of weight. He'd lost weight down to 80 kilos. If you remember, we started up with 85. And I had warned him initially that with the initial blood sugar control, he may have a little bit of weight gain. But actually, he lost a good amount of weight because of the SGLT2 inhibitor on board, in spite of the fact that his blood sugars improved. And it got his weight down to 80 kilos. Thereafter, he regained a little bit of weight after we reduced the dosage of the Empalina combination. The reason why we had decided to reduce the dose a little bit was because he felt that he was having some excess urination during the daytime and he was not very comfortable, though he did not have any dysuria or any problem like that. So I had said, okay, let's try reducing the tablet dosage in the morning. However, when he started regaining weight and his blood sugar, HbA1c started creeping up a little bit, we went back to Empalina full tablet in the morning. He continued with his metformin 500 mg at night, and he continues to remain on this combination till date. His fasting blood sugars remain around 100 to 105. His HbA1c is hovering around 6.5, 6.6, not dropping lower than that, but not going up more than this also. This unique combination of SGLT2 inhibitor with the empagliflozin gives us the opportunity to derive the benefits of SGLT2 inhibitors in terms of weight reduction and good sugar control, along with the glycemic efficacy of the DPP4 inhibitors, the safety of both of the molecules not causing a hypoglycemia, with a very potent reduction in the HbA1c and very good tolerability. When you initiate treatment with an SGLT2 inhibitor and DPP4 inhibitor, they have a much lower incidence of genitourinary side effects, which can be a deterrent to continued use, particularly among women. So when we initiate therapy with an SGLT2 inhibitor, we started with a combination. The chances of us being able to continue with the combination and the benefits that we are going to get from the SGLT2 inhibitor in terms of cardiac protection and the renal protection, we can continue with the usage of the SGLT2 inhibitor if you also have a DPP4 inhibitor on board. And the other point is that the DPP4 inhibitor actually enhances the efficacy of the SGLT2 inhibitor, because SGLT2 inhibitors have a tendency to increase glucagon, while DPP4 inhibitors, as we know, reduce glucagon. So we have enhanced glycemic efficacy of the SGLT2 inhibitors if it is combined with a DPP4 inhibitor. So I hope that this case illustrates that even with a very high HbA1c at baseline, usage of the appropriate medications in the absence of osmotic symptoms would help to cause, combined with a good low carbohydrate diet and exercise, will help to reduce the HbA1c to near normal glycemic levels, and we are able to maintain it there. Thank you very much.